It's been a minute since we've done a research update, and I wanted to share about the updated neonatal resuscitation guidelines that have been developed with the American Heart Association and the American Academy of Pediatrics, because this does affect the HIE community. So every 5 years, this is republished, things are added and changed, but things can be changed with emerging evidence and things like that with neonatal resuscitation and care. This is a very large document. It was published just a couple of weeks ago, and we're going to talk about the neonatal resuscitation portion of this, which is literally hundreds of pages long, but we're going to summarize. What I love about this is there is a guide that is published with this very large document and all of the guidelines that talks about why things are recommended, what the level of quality of evidence is, how this may influence standards of care, and also how it may influence you as a parent who may go on to have more children after HIE, want to know more about the process of what things have changed to now, or what the recommendations are now. Or if you're just curious that care changes and gets better with more evidence and data to support it. So this is a really important section because it talks about anticipating which babies may be at highest risk for needs of resuscitation and anticipating that risk and having the right care in place. These are the highest recommendations based on evidence, and then those that are nice to have based on some good evidence. What's really new in this section is the term, if you read through these, and you see this if you're combing through literature like a lot of our families will do, is seeing the term non-vigorous infant. They're typically talking, our kids would fall into that because those babies that need extra support when they're born, obviously that is a lot of the HIE community. So how babies are managed that are non-vigorous full-term newborns, those things have changed, and there's now new evidence because we've done the research on umbilical cord management. And a lot of people have talked about this for many years. Are there better or worse outcomes? If you always want to have a good sweet spot of ventilation and oxygen, right? You don't want to have too little oxygen or too much oxygen because that can be detrimental. You want to have too low of a temperature or too high of a temperature because that can be detrimental. So with this, it's like looking at delayed cord clamping and cord milking. And there was some scant evidence before that there might be an issue with if you're delayed cord clamping too long. And again, finding that right time that vacillates between what is optimal, what can go into causing unintended harm. When we talk about cord management and cord milking, this is a new concept. And again, there's going to be exclusion for our community if your baby had cord problems and their cord is extremely damaged, compressed, and a knot. Any of that's likely going to exclude you from your baby being able to have its cord milked or have delayed cord clamping because the cord has been compromised. But for those that don't have that can have this and be resuscitated at the same time, if there's enough resourcing, obviously, you can have clinicians that are resuscitating the baby as needed also have someone that is milking the cord. And that has shown improved outcomes, less need for cooling. Those babies don't qualify because they've been able to recover a lot quicker. So this does change management. And this is where it talks about the randomized controlled trial that included over 1,700 non-vigorous infants between 35 and 42 weeks gestational age, comparing those intact umbilical cord early cord clamping within 60 seconds of birth. Their initial primary outcome was looking at admission to the NICU, which was no different between the groups. So babies still needed to go to the NICU to be monitored or have other interventions, which is understandable, especially if you're going to be cooled, you're going to go to the NICU. However, compared to early cord clamping, intact umbilical cord milking was associated with decreases in several secondary outcomes, including the rate of CPR support in the delivery room, severe HIE, and the use of therapeutic hypothermia. So those are our kids, and that is really exciting. This is new evidence. We'll change practice to hopefully improve the care and outcomes of our kids. If you want to read these yourself, you can certainly Google them. It's at shajournals.org in Circulation, which is their big journal, and looking at Part 5, which is the Neonatal Resuscitation Guidelines update in 2025. We'll also have a blog post on our website you can check out.